Hello, welcome to Gay Liberation Network's live call-in show. Gay Liberation Network is a direct action group of activists for street action and marches throughout Chicago and the Midwest. And today our call-in show is focused on healthcare reform, which we've all heard a lot about from the Obama administration and the government's activities at this time. Today we have a special guest from Chicago Single Payer Action Network, Edward Crouse, here to speak with us on how healthcare reform relates to all of us, but particularly to LGBT people. Edward, I guess just to start off, define what is the problem and with our healthcare today and how it relates to LGBT people.
Okay, happy to do that. But before I do, I'd like to thank Mark Holman-Gomez for helping set this up. He's a member of both the GLN and C-SPAN, and I just wanted to throw some love and affection out there for him. The problem with healthcare, it's been discussed endlessly as Obama moves towards comprehensive health reform, which he says he wants to pass by August. But what we have in America is a situation where, according to a WHO report in 2000, we are about 34th, 37th, I can't remember the exact number, but we're pretty much in the back of the bus as far as world healthcare is concerned. We pay more than any other nation, and we get back less. We spend something like $7,000 per household. And the situation is dire. It's not that the bus is driving toward the cliff now, it's that it's over the cliff, and what Obama is proposing and what we're proposing are two competing systems. And he doesn't exactly, he's not exactly delivering on some campaign promises that he made, and that's not uncommon in our movement, and it's not uncommon in the gay and lesbian movement either. So that's sort of where we're at. That's the general picture.
So can you touch on maybe what the problem is with LGBT people in particular?
Sure. Well, in a way, the main problem is that we have a system that's employer-based, and we have a system that where people also get a lot of benefits through spouses. Now, of course, so it's intimately tied in with the gay marriage issue in a lot of ways. You get coverage through your spouse, but of course, if you're not allowed to be married, then you can't receive coverage. There are certain states and cities that have domestic partnerships on board, but that's of course very few and far between. And so what will get people health care is what gets people health care right now is they get it through their employer, and that's the sort of system that Obama wants to preserve, and that's actually one that we're fighting against. We're fighting against employer-based health care. What we're proposing, and what's actually been written and been on the legislative table in the House since 2003, is a bill called H.R. 676, which is a Medicare for all plan. Single payer, what it means in effect is that there's one entity, the government, which pays doctors, and you still have your choice of doctor. You get to keep your doctor. The only thing that the government does is actually pay the doctor. So it's pooling your resources, it's keeping costs down, because government programs have inherently low overhead. With insurance companies now, something like 20 to 30% of their costs incurred are just to themselves, skimming profits, and overhead, keeping their businesses in order. And so we have to eliminate that patchwork system, that very expensive system, and have an efficient government-run payment delivery system. And that's what Bill H.R. 676 proposes. I'm sorry, I got a little bit off topic there. Bring me back.
Well, we've got a caller in, actually, so maybe they'll put us back on topic. Joe?
Some of the things that some people are concerned about, if we overhaul the existing healthcare system that we have right now, well, we have to be concerned about doctors that are specialists, and it may not be worth them going to different types of specialties. Like, we got all different types of specialists in our country. And two, if we start overhaul our medical care, where we have the same type of problem they have in other countries, like in Canada, and I think also in England, where people have to wait very long period of time to see a doctor.
Well,
thank you, Joe.
That's a new question. I guess there's two parts to that question. It's whether or not we'll have to ration care, and I think the first part was about the intervention of specialists. Right now, the way our system works is that it does reward high technology things, lots of procedures, lots of specialists, our care is not geared toward preventive care. And so if you just need a basic doctor, what a lot of people, especially the 50 million uninsured there are out there, the hundreds of millions that are underinsured, that are insured, but their payment, their coverage doesn't extend to certain basic things, or there's lots of pre-existing conditions, is a lot of people go to the emergency room for care right now in our country. And so when they do that, all the money that's spent paying for those people are still incurred by the system. So we're already paying for people. Now, in a system where everybody's in and nobody's out, and everybody pays through a mild hike in their taxes, employers will have something like a 7% under our plan, and people would pay maybe 2% more, which maybe sounds like a lot in terms of taxes, but think of how much you're paying right now. It'd be a lot less than paying $7,000 a year, which is what on the average people pay. What was the second part of that question? Sorry. As far as rationing goes, nobody ever goes bankrupt in those countries because of healthcare concerns. And if they need emergency treatment, it's always provided. All the preventive care, the things that are rationed are things that are considered elective surgeries, which is going to be a bit of a controversy, especially when it comes to transgendered people. But nobody dies waiting for care the way they do here, and nobody ever goes bankrupt in those countries. And sorry.
I just wanted to. So let's take the lesbian with breast cancer,
Yes.
the gay man with HIV.
Yes.
What changes for them under this system if we move to either the single payer system that you're talking about, or some aspect of what the government is discussing?
Well, then I have to distinguish between what Obama's doing and what we're proposing. No, I'm not even going to get into what Obama's proposing. Under single payer, everything that's medically necessary is covered. Now the people who decide what is medically necessary now in the current system are the insurance companies. Doctors, the ones who support our movement, the ones who've helped author the bill, are part of an organization called Physicians for a National Health Program. They've been working since the Truman administration on getting national health care going, and they sponsor that bill. Anyway, sorry, where was I going with this?
So how does single payer system change access to health care?
I know what I was going to say. Yes, they in the current system, actual doctors would decide what's medically necessary. The way it works now is it's your insurance provider who says you can and can't have this. And it's horrible in terms of women, especially say the lesbian with breast cancer. Women's health is pathologized under the current system. Pregnancy is considered a pre-existing condition. Menopause, yeast infections. I mean, people are not treated because of all of these things and the way it works. And under a single payer system, all of those things, the naturally occurring biological function of people, whether they're gay or straight, are going to be covered. It sounds a bit utopian, but that's the way it works in other countries that have the system. Sorry.
And currently, you only have the ability to pay and to go somewhere other than an emergency room if you have insurance, basically.
Yeah. I mean, you can pay by the visit, but it's exorbitant. Yeah.
Right. Under the under what Chicago's Single Payer Action Network proposes, is everyone covered?
Mm-hmm. That's our system. Everyone is in and nobody's out, and that's the place where you have to start. Where Obama is starting from is we have to keep costs down, we have to keep it efficient, we have to make sure that people's current insurance isn't disrupted. This would be a good place to distinguish between the plan that we're proposing and what Obama has proposed. Under single-payer healthcare, the government pays, that's publicly paid, for your privately delivered care. Privately, you and your doctor decide on the treatment that's necessary, and you have your choice of doctor in that system. That's why the argument is fallacious that care is going to be rationed or the government's going to prescribe your health care. No, you decide your doctor, and if you don't like your doctor, you move on to somebody else. And if you don't, and it also frees you in terms of your job. Like I said earlier about employer-based coverage, if you don't like your job, but you can't leave it because you have to get health insurance through that job, you can leave it because you will always be covered. And that's what it is. I'm sorry.
So a major difference between the single payer system and the direction that the government appears to be moving right now is that all individuals aren't going to be treated as individuals.
No, you're going to have to buy coverage from the government in the way it's being proposed currently. So we're still going to have something
and only
called
if you're
insurance.
employed.
No, I mean you're going to buy what he's going to offer right now, or he's saying he's going to offer. It's still legislation still hasn't been written yet, but so it's all speculation and in some cases magical thinking. But what you're going to have to buy coverage, and coverage will still be provided by private insurance companies, the same corrupt private insurance companies that are spending $1.4 million a day to lobby against this very public option that he's proposing. They'll still be in the game, and what he's going to offer though is a system that will cover. That you will still have to buy for the 50 million uninsured and anybody who wants to jump on board. So that's what he's proposing. He's still proposing insurance. What we're proposing is eliminating insurance companies altogether. They've proven themselves bad stewards of the healthcare delivery system, and they don't deserve a place at the table anymore. That's the major difference. But yeah.
Okay. And it would still be up to these insurance companies to. And for LGBT, can you just take us through some of the major effects of having the insurance companies? If the insurance companies are still involved, as opposed to having it switch over to a government system.
If they're like I said, it's a patchwork. They can discount all kinds of things off of they can disenfranchise all sorts of people, especially transgendered people. Transgendered people are forced to choose a gender under the current system. Even though a lot of them, don't want to undergo gender reassignment, are still biologically a woman. If you're a trans man, for instance, and you're still biologically a woman, you're still going to need to look out for things like cervical cancer, ovarian cancer. But so you have to remain female on the books on this system. Under single payer, at least there will be a government, like one system to mediate all of that, rather than a bunch of insurance companies who may, have you in the crosshairs.
And that's also important for the recognition of couples, because now some insurance companies do recognize us as domestic partners, in same-sex couples, and some companies do not.
Right, it's true. I mean, if healthcare continues to be tied to marital benefits, then it's inherently unequal for people who can't get married legally. So we can solve, like I said earlier, the marriage issue by, chipping away at that edifice and getting, making sure that people can be married, gay people can be married, or right now another way for your spouse to get benefits, or your partner, would be to have everybody covered. It's sort of a weird libertarian argument, actually. It's just like I can't specifically, if you read HR 676, it doesn't specifically address gay people, but everybody is in and nobody's out, and that also includes illegal immigrants. I mean, not illegal immigrants. People who are immigrants and who are working in this country. So that might be a controversial part of the bill, but that's also an issue in a lot of domestic partnerships, is that you have somebody from another country that you're shacked up with.
Okay, we are speaking this evening with Edward Crouse from Chicago Single Payer Action Network about the healthcare reform in this country and its effect on LGBT people. We've got a few, and here is their website, www.shyspan.org. Check it out, and they have a variety of street actions and other direct action efforts that they make.
Talk about the rally now, or
feel free. Okay,
just for everybody out there watching us, we do have a rally for comprehensive health care for the country, contrary to what Obama is proposing. It sounds kind of counterintuitive, but anyway, it's July 15th. It's at the Tribune WGN building, and that's at 435 North Michigan, Wednesday, July 15th at noon, high noon for insurance companies.
And Gay Liberation Network has a few events coming up as well. Primarily this Tuesday, July 14th, we will be in Wheaton, Illinois, the near west suburb, at a protest of Exodus International. Exodus International uses Christianity as the basis for its supposed cure of homosexuality in the population, and the creation of what people term themselves as ex-gays. There has been a variety of scholarly work that discredits these efforts, and as well as just a variety of anecdotal evidence of folks that are seriously psychologically harmed by going through these efforts. We are there to expose this fraud. Please email us if you'd like to arrange transportation to the event or show up there on Tuesday, July 14th at 6:30 p.m. Email is on the screen. Following that, next week, Saturday, July 18th, we will be in Joliet. Joliet at 2 p.m. in the afternoon. We need to address gay rights and the fact that gays are in every community in Illinois, particularly with regards to legislation for marriage here in the state of Illinois. We will have speakers about a variety of topics there, and this event is in coordination with Community Alliance and Action Network based in Joliet. So, right now, healthcare is in the news a lot. Yes. Here in Illinois and across the country, just because of budget cuts for, the disabled and mm-hmm. people that are currently getting government-sponsored care. Yeah. Tell us about how that changes and what the benefits are under a single-payer system.
Well, the system, as it is currently structured, could basically pay for itself if we eliminated insurance companies. It would cost something like $350 billion a year, but with everybody paying for everybody and everybody looking out for everybody, then it would actually save a great deal of money, especially on the level of businesses. One of the things I kind of don't understand about the movement is why businesses won't stand up against insurance companies, because they've really pretty much hold this economy and the healthcare delivery system hostage right now. I mean, let's be honest. So, I mean, if small business owners weren't forced to pick up the cost of healthcare, and they're not, well, often, a lot of time they're opting not to, but large businesses, are stuck with all these healthcare costs. We saw the bankruptcy of GM and how those benefits. And how much more profitable is GM if you just go across the border to Canada? I mean, just look that up. It's phenomenally different there when the employer doesn't have to pick up the tab. So that's what the most perplexing thing about this is Obama is proposing all of these voluntary regulations for these inherently wasteful companies. And we see how well voluntary regulation works. We've seen how well it worked as far as the economic collapse. We've seen where the TARP money's gone. It's not come out, and businesses are just holding on. And so that's why we think that they don't deserve to be part of the healthcare delivery system. But yeah, that's.
So you have some other points.
I do. I definitely do. As far as transgendered people go, I mean, let me just emphasize that even though everybody will be covered for all of your basic healthcare needs, and you'll never go bankrupt as a result of medical bills because of this, it will eliminate all copays. I mean, it's not a magic bullet solution. You're still going to have providers who are homophobic. It's still a matter of changing hearts and minds, as they said in Vietnam. In this battle. So, I mean, it's the same way with gay marriage. You can win gay marriage, and you may very well, and it's been won in many states, but that's still not going to, make it any easier. You have to be, as usual, out, loud, proud, all of those things. The other thing is it's interesting. I saw a movie called She's a Boy I Knew that played in the Chicago Underground Film Festival last year. It's from a filmmaker named Gwen Haworth, who is a male-to-female transsexual. And it actually is very, very engrossing not just on an emotional and documentary and diaristic level, but it is a portrait of a man changing into a woman through the Canadian healthcare system, which is a single-payer healthcare system, and it was very efficient. It has low overhead and all of these things. But despite all of these things, she runs into a lot of the same, BS that transgender people do here. She was eligible to get hormones, I think, through Medicare in Canada. That's what their system's called. But in order to get that referral, she had to go to her general practitioner, and her general practitioner basically led her on this wild goose chase and didn't send the proper forms in for 6 months because she was transphobic. So she found somebody in Vancouver. And so the sort of labyrinth that she has to navigate, it's well worth looking into. It's a great film. It's called She's a Boy I Knew. But anyway, even in Canada, though, a lot of psychiatric care, a lot of they needed a psychiatrist, they needed a counselor before all of these things, before they could approve a lot of these things and then get approval. But she covered most of the procedures out of pocket. I think they still have, for what this is considered elective surgery or something. But
and how is it currently handled here in the U.S.?
It's homophobic. Yeah,
it depends on do any insurance companies cover it?
I don't really think they do. No, I really do think it's like a lot of. I mean, it's funny how certain sexual conditions in surgery can be addressed, erectile dysfunction being the most prominent and engorged one in our society, but other people's needs can't be met. Yeah.
We've got a caller, Tiffany.
Hi, Tiffany.
Hi, how are you?
Good, thanks.
Okay, my question is that I'm a lesbian, and I recently went to the doctor, and the doctor wouldn't give me any medical attention because he doesn't believe in homosexuality. So is that can I sue him or anything?
I have no idea as far as I mean, you can definitely sue him, but I think as far as actually getting the care you need, you just need to go to a different provider. But I think there's definitely a case there that can be made for non-discrimination. Although, it's even on the books as far as transgender people in this country goes. You can still be fired for being for not fitting into the gender model of a workplace. You can't be fired on race or sex, but if you're transgendered, you can still. But anyway, I think you do have a case to answer your question.
Yeah, as well as there are some websites that may be able to help you at least find immediate care for your concern, and that one, I think, is lccp.org, the Lesbian Care Project. And, but yes, I mean, there's continues to be a lot of, discussion in the, So why don't you sum up just for us how things would be better for GLBT people under a single payer system versus the current?
Sure, it would be a lot better under a single payer system, but mainly because everything would be covered, including a lot of mental health. As you know, a lot of LGBT youth require a lot of suicide counseling, and so you would get the psychiatric care that you need. You would get a lot of just your basic screenings done. It wouldn't cost you an arm and a leg, and I think we're about out, so thanks so much.
Yeah, no, thank you, Edward. And want to remind everyone about GLN's next action, protesting Exodus International in Wheaton, Illinois. Check out the website, gayliberation.net, or email us. Joliet, next Saturday at 2 p.m. Also check out our website, gayliberationnetwork.net. GLN has a monthly meeting the first Wednesday of every month. The next one is August 5th at 7 p.m. at Gerbert Hart Library at the Granville Red Line stop. And Gay Liberation Network will be back here on CAN TV at 6:30 p.m. Friday, July 24th. That is only 2 weeks away. And we want to thank again Edward Crouse of Chicago Single Payer Action Network for joining us. Check them out, shyspan.org.
And just, do we have 20 seconds? Are we going out?
Yeah.
Our rally is July 15th at noon at 435 North Michigan. Thanks so much, everybody.
Have a good night.
Thank you.